Mental health has gradually entered India's public health vocabulary, yet its presence remains faint compared to the scale of the problem. Behind policy documents, awareness campaigns, and periodic discussions lies a persistent emergency that claims thousands of lives each year. The National Mental Health Survey, 2015-16, estimates that nearly 1 in 7 Indians lives with a mental disorder, but treatment reaches only a small fraction of those affected. This gap between need and care is not merely a matter of resources. It is also shaped by culture, gender norms, and structural failures. Within this already strained landscape, men's mental health represents an especially neglected crisis, one that remains largely invisible despite its devastating consequences. Statistical patterns reveal the depth of the problem. Men die by suicide at rates far higher than women, with recent data showing more than twice as many male suicides in a single year. While women report higher levels of internalized conditions such as anxiety and depression, men are more likely to display externalized distress through substance abuse, aggression, and self-destructive behaviors. These differences are often misunderstood as signs of resilience or strength, when in reality they reflect distinct ways of expressing psychological pain. Public conversations on gender and mental health have understandably focused on women's experiences of inequality, violence, and disproportionate care burdens. Yet this necessary focus has inadvertently contributed to the erasure of men's suffering, reinforcing the idea that men either do not struggle or should not speak about it. At the heart of this crisis lies a deeply embedded cultural script. Emotional restraint is widely treated as a defining feature of masculinity in India. From a young age, boys learn that vulnerability is incompatible with being strong, and that expressing fear, sadness, or confusion invites ridicule. These lessons are not innate. They are taught, reinforced, and normalized by families, peers, and institutions. Over time, silence becomes habitual, and distress is pushed inward or channeled into behaviors that are socially tolerated, even if harmful. Evidence from community-based research illustrates how early this conditioning begins. Studies conducted among adolescents in urban slums reveal that boys struggling with addiction, depression, or suicidal thoughts often face resistance rather than support when they attempt to seek help. Peer groups discourage participation in counseling or support meetings, framing mental health concerns as signs of weakness or abnormality. Families, too, may deny or minimize problems, fearing social stigma more than psychological harm. These responses send a clear message: suffering must be hidden, and help-seeking is a source of shame. Such experiences demonstrate that silence is not a personal failure but a social outcome. Adolescents internalize the belief that their worth depends on endurance, not expression. When moments of crisis arise, many lack the language or permission to articulate what they feel. In some cases, timely intervention, through patient listening, trust building, and non-judgmental engagement, can interrupt this trajectory. Stories of young men stepping back from self-harm after being heard underscore the transformative power of empathy. Yet these moments are often exceptions rather than the norm, constrained by limited outreach and inconsistent support systems. The patterns established in adolescence frequently persist into adulthood. Research among adult men in rural communities highlights a continuity of attitudes shaped by stigma, fear of exposure, and concerns about social standing. Men speak of avoiding mental health services because of the absence of privacy, the risk of gossip, and the anticipation of ridicule. For many, acknowledging distress threatens not only their self-image, but also their role as providers and decision-makers within families. The pressure to appear in control becomes heavier as economic responsibilities increase, leaving little room to admit vulnerability. Structural barriers further intensify these cultural constraints. India's mental health care infrastructure remains under-resourced and unevenly distributed, particularly in rural and economically disadvantaged areas. Even when men overcome stigma and decide to seek help, they often encounter confusing pathways, long waiting times, and a lack of clear information about where to go or whom to consult. Public health facilities are frequently ill-equipped to handle mental health concerns, and referrals can become a frustrating cycle rather than a source of relief. For individuals with limited financial means, private care is often inaccessible, reinforcing the perception that mental health care is a privilege rather than a right. The impact of these systemic gaps is most visible among working-class men, especially daily wage earners. Economic insecurity, irregular employment, and debt create chronic stress, which is compounded by the expectation that men must remain stoic providers regardless of circumstances. Data showing a sharp rise in suicide rates among male daily wage workers over recent years point to the lethal intersection of financial precarity and psychological distress. For these men, seeking help may mean losing a day's wages, traveling long distances, or exposing personal struggles in settings that lack confidentiality. The cost of care is not only monetary, it is social and emotional. Substance use often emerges as a coping mechanism within this context. Alcohol and other substances provide temporary relief from anxiety and despair while aligning with socially acceptable expressions of masculinity. Over time, however, they deepen mental health problems, strain relationships, and increase the risk of violence and self-harm. The tendency to frame substance abuse as a moral failing rather than a mental health issue further isolates those affected, making recovery more difficult. Addressing men's mental health in India therefore requires more than expanding clinical services. It demands a fundamental shift in how masculinity, vulnerability, and care are understood. Cultural narratives that equate strength with silence must be challenged through education, media representation, and community engagement. Boys and men need to see models of masculinity that allow for emotional expression without diminishing dignity. Schools, workplaces, and local institutions can play a crucial role by normalizing conversations about mental well-being and teaching emotional literacy from an early age. Community-based interventions offer valuable insights into what works. When mental health support is embedded within familiar settings and delivered by trusted individuals, resistance decreases. Volunteers and peer facilitators who listen without judgment can bridge the gap between need and care, especially in underserved areas. Such approaches also help counter the fear of stigma by reframing help-seeking as a collective, rather than individual responsibility. Policy responses must also be sensitive to gendered realities. While gender-neutral frameworks are important, they should not obscure the specific ways in which men experience and express distress. Suicide prevention strategies, for instance, need to account for occupational risks, substance use patterns, and social isolation among men. Integrating mental health services with employment schemes, primary health care, and social welfare programs can reduce barriers and make support more accessible. Ultimately, the crisis of men's mental health in India is not separate from broader struggles around inequality, poverty, and social change. It reflects the costs of rigid gender norms imposed on individuals navigating an increasingly uncertain world. The silence surrounding men's suffering is sustained not because it is natural, but because it is convenient, allowing families, communities, and systems to avoid confronting uncomfortable truths. Breaking this silence is both an ethical and practical necessity. Each story of a man who finds relief through understanding rather than judgment challenges the myth that endurance alone is virtuous. Recognizing men as emotional beings, capable of pain and deserving of care, does not detract from the urgency of women's mental health concerns. Instead, it strengthens the case for a more inclusive, humane approach to well-being, one that acknowledges difference without hierarchy. India's mental health discourse stands at a crossroads. The data are clear, the stories compelling, and the costs of inaction devastating. To continue ignoring men's mental health is to accept preventable loss as inevitable. A society that truly values resilience must redefine it, not as silent suffering, but as the courage to seek help, to listen, and to care. Thank you so much for watching my video. Please like, share, and subscribe to my channel. Thank you.